Motion is lotion. That's what this video series is all about. Myoskeletal alignment techniques and movement-based therapies, trying to see how we can lace these two together. So I brought in Paul Kelly here.
What we're seeing here with Matt is elevation on this left side, and then now we're seeing here coming from his shoulder girdle, traversing crossing here to the abdominal fascia and external internal oblique, coming across in here and actually ending up into his adductor, finishing into the adductor, into the also rectus femoris, maybe even some psoas problems coming across here. And then as we spin him around, let's just go ahead and take a look at this back pattern, and I'll have Erik talk a little bit about what he's seeing here.
The body's a spiraling system. Lowell talked about that in the 1900s. We don't look at people in 3 dimensions enough. We look sagittal, we look coronal, we don't look in the transverse plane. That's what we got to do. We got to visualize this guy in 3 dimensions. So when he comes down, look at this again, watch it closely how he goes down to that trick movement that pulls him off to the...
Head's coming off to the right just a little bit.
Yep.
And you can see how it's coming back left right here.
So we talked about Matt and his key lesion. Anytime you have a problem with the upper cervical complex, OA, AA, occipital joint, atlas axis joints, cranial-cervical junction, you've got to deal with that first. The goal of myoskeletal alignment is to level the sacral base and to get good alignment up here, right?
Right. It's a brother-sister relationship. Always remember that. If you don't get anything else done in your session, try to level the head and the tail. So we're going to turn Matt around here. I'm going to ask him a couple questions on, Matt, why do you think you have this pattern? What was your past?
I was in the Marine Corps infantry before. Did 2 tours to Iraq and Afghanistan, so I had a real heavy load on my body all the time in a firing stance. I'd get fatigued a little bit. I'd start to twist, or if I had to do a reload, grab my magazine.
Okay, did y'all catch that right there? Did you see what he just did? That's the pattern that we're trying to correct.